Hi, I'm Jay Downing. Welcome back from break and meeting with your groups. In this next session, we are going to talk about strategies in gender affirming surgery research. So basically, we're going to kind of give you a crash course in gender affirming surgery research, talk very quickly about some common approaches and some challenges in this field. So there are several challenges and ethical considerations that are unique to doing research with this population. Just like trans health is health and trans research is also research, there are, challenges in all kinds of research, but there are also some that are specific to doing research with this population. And personally, this is why I love doing this work. There's so many methodological and considerations that are unique, and I think we have a lot of opportunity to overcome. So the first is around measurement, and so what I mean by that is the measurement of our population. So if, for example, we were trying to do research on folks who needed to get knee surgeries, we could, pull charts from folks who who have a particular diagnosis related to their knee and, call that our target population. However, when we're thinking about who would be our population that would be eligible or need gender affirming genital surgeries, that's a lot more complicated because of issues of access and the way that's measured, in various types of data and self-reported. So we think about those things when doing our research. Another thing is outcomes. So what I mean by that is when we're doing research in this area, what are the outcomes that we're most interested in? And I think we're going to talk a lot today about some of that in our small groups. But historically, this has been a challenging consideration from a funding perspective because the big funders like National Institutes of Health historically have given funding for diseases. So they want to know, does getting surgery actually improve your mental health? Does it improve your X, Y, and Z? These are things that are not necessarily important to our community, but the way that it's set up from a funding perspective is a little bit misaligned. Next is around small sample sizes. So this is a problem for several reasons, not only from a statistical perspective, not getting enough folks in our population because this is still a fairly rare type of research, but also from an ethical perspective, because we have such a small population, the folks that are participating in our research are often asked many times to be involved in many types of research studies. And that places really an undue burden on the participants. So these are some things to think about, and I think our panelist that will talk next will address some of them. I'm just briefly going to talk about sort of the high level, like what are some approaches that folks in the past have taken to studying mostly trans health. And so first is a population-based approach. There's also a health systems, a clinic-based, and a venue-based approach. So when you think about population-based approaches for gender affirming surgery, if we were to want to know how many people in the US got said surgery, it would be really hard to do that because we simply don't have that kind of data. So a survey like the TransPop is, I believe, one of the first population-based surveys that actually can get at that kind of question. But beyond surveying, which is can be very expensive, time-consuming, and exclude folks who might not be traditionally reached by population-based surveys, registries can be really effective, right? So certain diseases require the hospital or the public health system is required to report particular outcomes to a centralized disease registry. In the same way, I believe we don't have this currently, but in the same way we could have a registry of all gender affirming genital surgeries where we could have that as a repository. So that would be an example of a population-based approach if so everyone was required to participate in that kind of approach. Health systems-based approach, we'll probably hear a little bit more about that shortly from Maddie, but this is this type of research that I do the most. So what we mean by that is getting data from either electronic health records or claims data. So we could, for example, we're doing some work right now with Medicaid claims data, and we can identify folks who have had surgeries and look at their outcomes before and after the surgery and over time. In the same way, we can do that with electronic health records. If folks record their gender identity or there's something in notes or ICD codes from that can serve as a rich source of data. The challenges to working with those kind of data, if, for example, you're trying to study issues around access, or you're trying to study outcomes that are not traditionally captured by claims. There's not a claim after the surgery for how good you feel or other sort of outcomes that might be important to you. So that would be a huge limitation of using the health systems-based approach. Another approach that has been used really often is a clinic-based approach, and probably one that's most prevalent in the research on gender-affirming genital surgeries to date. So that's where a health system or a particular hospital does a study within their own system. And this tends to be nice because the conditions of the hospital, the surgeons, and so you can really say a lot about that particular hospital. But you can't say something about surgeries in general or about all surgeries if they're done so differently across health systems. So while these are easier to conduct, typically less expensive than the two prior approaches, they do have their limitations. And also I meant to say that the major challenges of the clinic-based and the health systems-based approach is that they rely on that folks are going to a clinic for their care, which could be a problem for more marginalized populations. So that's when the venue-based approach comes in. So this is sort of the oldest and most trusted source of an approach that was used first in research on trans and queer folks. So that means basically going to venues, bars, coffee shops, etc., that we frequent regularly and recruiting participants that might be otherwise harder to reach. They don't access healthcare regularly or, shift workers, etc. And you can get better kind of biospecimen data on these folks, but again, that's not happening in a health system. And you can say a lot about a particular geographic area, but you won't be able to say anything about things happening nationwide from these approaches. So anyway, this was a very quick crash course in some approaches that have been used. I'm going to turn it over next to first introduce our guest speakers who will share stuff about their work. So first is Jay Savelis, who is at UCSF, and they will be discussing community-based participatory research. And next up, we will have Mahri Bahati, who is part of the PRIDE study and will share their approach on survey-based research. And finally, we will have Maddie Deutsch, who's representing UCSF and USPath, and they will talk about some work related to electronic health records. I hope you enjoy these presentations. Thank you.